With only 5 years remaining towards achieving the Millennium Development Goals (MDGs), there is a clear need for scaling up quality and effective HIV interventions if MDGs number 4, 5 and 6 are to be met. These efforts call for renewed commitment to developing the requisite capacity to develop and implement effective HIV interventions in the Eastern and Southern Africa region. In order to deal with the HIV and AIDS menace, Regional AIDS Training Network (RATN), established in 1997, has been focusing in building capacity for effective regional HIV response. RATN is a consortium of training institutions working in 11 countries in Eastern and Southern Africa, where it currently has 29 full members and 4 associate members. These countries are Kenya, Uganda, Zambia, Tanzania, Botswana, Zimbabwe, Malawi, Rwanda, Swaziland, South Africa and Lesotho. By strengthening the capacity of individuals, organizations and other stakeholders in the area of HIV and AIDS, RATN envisions a society with the capacity to respond effectively to the HIV and AIDS pandemic in the Eastern and Southern Africa region. The exchange of good practices and experiences among RATN membership institutions is key in scaling up positive interventions. With a membership of 29 training member institutions, RATN is helping in developing and delivering skills targeted at STI HIV/AIDS workers, trainers, program managers and senior policymakers. RATN member institutions are drawn from governments, international NGOs, national and local NGOs, management institutions as well as university departments. RATN's uniqueness lies in the principle of networking to tackle system barriers to addressing training and capacity development gaps that allow for cross-fertilization of best practices and tools for effective HIV training and capacity building. At least 75% of RATN's training programs are tailored to address the needs of adult learners whose learning skills are supposed to take into account experiences and challenges that come along with adult training courses. The training looks into HIV thematic areas, namely HIV prevention, treatment care and support, impact mitigation, and institutional development.
I would want to thank RATN for the hard work they're doing. I'm one of the beneficiaries of RATN because part of my sponsorship money came from RATN. My area of work involves trainings, counseling, mostly people living with HIV, and I have successfully excelled in this work because of the skills and trainings that I have undergone with KPC and RATN.
RATN's model of training of trainers has also been at the center of RATN's training programs and whose aim is to strengthen the culture of excellence in course content and delivery among RATN member institutions. Over 80% of the respondents trained by RATN have reported improved operational skills in their workplace. There have also been increased levels of confidence and interpersonal skills with clients. RATN has a reputation for quality that is largely the result of its systematic and comprehensive approach to quality assurance in its training and information sharing, as well as knowledge management programs. The RATN training program is distinct in instructional plans and the use of adult learning and participatory approach that include case studies, group discussions, personal experiences, and the development of work plans that are incorporated within the RATN training methodologies that will translate to improved performance at places of work. Through learning from past experiences and practices, RATN continues to bridge the capacity gap to ensure there is adequate capacity to scale up HIV response in the region.